make its way off of us. Maybe it's tension that we carry. I don't know where you carry yours, your jaw, your neck, your shoulders, hands. And we can take a deep breath in and a deep breath out. We might remember the Hebrew word for wind or breath or spirit is ruach. And so we can remember as we breathe in and breathe out, God's spirit is as near to us as the breath is before our face. We'll take just a moment to allow that spirit to help us still our minds. Our minds, which we might imagine as a river. And thoughts will drift into view. They always do. But instead of holding on to the thoughts, just for this moment anyway, we'll let them drift on by. And we can listen for however it is that God's Spirit might speak to us. And then into this silence, I'll invite us for another moment of silence and grief and sorrow, perhaps anger, to remember the 8 people who died in Georgia yesterday evening, 6 of them of Asian descent. And us being no strangers to hardship or loss, we can trust that we're bound by God's Spirit to all those experiencing pain and grief in these hours. So we would ask, oh God, that you'd be with us, with all those who have lost loved ones, with all those whose world is fractured. Be especially with all of those living with and working around the immense challenges that COVID has presented, and be with us as we gather now as your people. In your holy name we pray. Amen.
Amen. So I'm going to just do a little bit of kind of setting our foundation. If you were with us 2 weeks ago, we talked a lot about the vaccine in terms of how the science of how it works and how herd immunity works, and some basic foundational considerations like, are you feeling burnt out? And how might that hinder your decision making? What are the values of your community, and how can you express those in the way that you think about regathering? So just for our conversation today, real quick, our goal is for different churches to share how they're thinking about this, to hear different ideas and consider what makes most sense for you. We are not trying to tell you what to do, provide a one-size-fits-all solution. We're not really trying to provide an opportunity to critique or debate either. We just want to respect each other and to understand that different things will make sense in different communities. And we'll ask also that you just put your questions in the chat, and that Carl and I will be watching to help make sure that all of those get answered. I think that's the most equitable way to kind of make sure that everyone gets a chance to say what they need to say. So does that sound all right? Good, I see nodding, thank you. So a few words to undergird us from the Wisconsin Council of Churches. I don't know if you got a chance to look at this report that was kind of linked with the announcement about today's meeting, but Carl and I thought it was so helpful in thinking about how we think about regathering. So just a few things that they tell you, and you can go and look at that in more detail afterwards. But there's a 2-step approach to gathering, thinking about both vaccination rates and viral transmission rates. So you can see these kind of different guidelines, and some of our churches who are here today may have already decided there are some metrics that they're going to use, and they'll tell us more about that later, but these could be helpful, especially we know in times of high stress or potentially traumatic events like this one. Safety, predictability, and control are really helpful to people in making it through and building their resilience. So telling your congregation, you know, here are the metrics we're looking for could help to provide them some of that control and predictability that none of us have at any time right now. This is an interesting chart from them also. They said, expect these to continue for a long time, which, yeah. So thinking about how we make our spaces safer with masks, with distancing, thinking about using outdoor spaces. What I thought was interesting was the shortened time of service. They recommended 30 minutes for those gathering kind of before, you know, things feel totally safe, whatever totally safe is going to mean. And also having a sign-in list or some kind of way to track attendance in case there's some kind of an outbreak. The always sticky question about singing, they also address, noting that it's a pretty risky, unsafe behavior, but there are ways to make it safer. And to be safest, it would be one of the last things that we reintroduce. They also have some guidance about meals and Eucharist and visits. And we'll send out the link to this article again, so you can be sure you have it. And we're recording this webinar as well. And just our guidelines for making decisions. So committing to a guiding authority for your decision. If you're looking at metrics from the New York Times and then you decide to choose a different source one day, you know, you may not be comparing apples to apples. So just really being sure about what source you're taking and continuing to use that same source. We've talked a lot about this already, choosing a risk level, what level of risk is acceptable for your community, what makes sense for your community. A statistical source, like picking the same source, and then a guiding authority, it could be like the CDC, for example. And then you might want to have a phasing plan if you're thinking about going back, you know, with some restrictions at some point and then kind of easing the restrictions. So what will be your cue that you're going to change the restrictions, or that things will, certain practices will be lifted. They recommend that you hold each phase at least 4 weeks, and then also have a plan not only for how are you going to move forward, but how might you also roll them back if that becomes necessary. Hopefully it won't, but there's still a lot that we don't know. So fun. And then to have a plan also in case of an outbreak. So that's just real quick little foundation from some folks who have been providing pretty good guidance continually throughout this experience. And now I think we're going to hear from some of our churches about what they are thinking.
Great. So as I said, we just had lined up a few people to share, a handful of people to share about what they're doing. John Sawyer, if you'd be willing to share a little bit first, we're ready to listen.
Sure. And also on the call today is Jill Pennington from our COVID-19 task force here at the church. I don't know if she would want to share. She's joining from work, and so I don't know if she's hiding from students or not in between classes. But I'm John Sawyer, and I am the pastor at Bedford Presbyterian Church in Bedford, New Hampshire. And Carl reached out and asked me to kind of say what we are currently doing. And I guess I'll start by saying what we have been doing for the past year. I know that some people are doing like a Zoom service from home or a live stream from their homes. There's a very rambunctious 3-year-old who lives at my home. And so very early on, I said that I couldn't do a live stream from my house. Just because there was no place for me to do it except for from my basement. So we set out last year to do live stream from our sanctuary at Bedford Presbyterian. Our sanctuary was built in the 1830s, and it seats close to 400 people. And our session and our COVID-19 task force determined that we could have at least 10 people in that large space that were spread out and masked in order to make our live streams work. So we have some technical people in the balcony, all wearing masks. We have an elder and deacon of the day, all wearing masks, and I wear a mask, except for when we're speaking on camera. And when someone is speaking or singing on camera, then everybody else is spread out away from them. We also have a music director and a soloist who will sing. And again, people are masked when they're moving around, and there are some singers who will be masked and some singers who are unmasked. The Masked Singer was that TV show. We don't do that, but just a surgical mask. So anyway, so we've been doing that, having about 10 people in the sanctuary total. Last fall, we tried to open it up just a little bit more to add 10 additional people. So a total of 20 people in our sanctuary, all spread out, socially distant, all wearing masks the whole time. During the December surge, we brought it back down to just 10 people in the sanctuary, and we've been able to keep it at around 10 for the most part. There have been a couple Sundays where we've had a few extra folks, and we actually had a Sunday where like this random couple showed up just wanting to visit church, and they just walked right in. And so what was I supposed to do but show them to a pew and give them a bulletin and say, hello, welcome. So our COVID-19 task force has recommended, and on that task force, we have our clerk of session, a doctor from a local hospital who's a surgeon, and his wife who works at another hospital as a pharmacist. We have a school teacher, Jill Pennington, who's on this call today. And we have, another guy who does science research for his company and looks at statistics all day. And we have another person who's kind of just a concerned member of the congregation who we've asked to be part of it. So a good little kind of cross section of who we are and some real good knowledge that they bring to the table. So they voted to allow in addition to the 10 people who run the service, an additional 15 people in the sanctuary, socially distant, everybody wearing masks. And we're going to hold that kind of 15-person additional 15 number person, a total of 25 in the sanctuary for the foreseeable future until the numbers in New Hampshire continue to go down and vaccinations continue to rise. And so we're just trying to be very cautious. I'm sure all of us have heard from relatives and people who live around the country, as well as other churches in our communities who are, opening up and a lot of people being present together. We've decided to go with very cautious numbers initially. And we feel, and thankfully, a majority of our congregation has been very supportive of this cautious approach. One last thing before I hand it over to the next person is this past Sunday was the first Sunday that we opened it up to have 15 people. They can sign up online through an online service called rsvp.church. So we had space for 15. We only had 3 sign up. So people are kind of self-selecting cautiously to be part of our in-person live stream. So I guess, I don't know if you all have questions now or if we want to wait for questions later, but that's kind of what we're doing here in Bedford. And Jill, I don't know if Jill has anything to share in addition, not to put her on the spot.
Yeah. Hi, I would just say you might add what you've been doing with regard to communion or not. And there's been a significant, in addition to the live stream worship, a significant mail effort, like snail mail, to get out information to folks. We've been communicating, and I say we real loosely, it's not been an effort on my part, lots of good leadership in the church working to get information out through the mail, to get out things like Advent wreaths to our membership at home. It's been really appreciated stuff for children's ministry, going out to folks in their homes. It just, not just the website information where bulletins are are to be found, but also like physical stuff coming to homes. I think that's been an important component of trying to keep people connected thus far.
Thank you, Jill.
Thank you.
Yes.
Yeah, John. So, John, I see one. I was thinking we'd sort of hear from people first, but I just saw one question come in, a clarifying question. Are you allowing singing amongst people who are gathered or no?
Yes, I just saw that question from Rob Mark. We are allowing singing, but everybody is spread out so far apart and they are masked, except for the people who are leading singing. And the people who are leading singing are myself and the special musician of the day, and we are spread apart by at least 20 feet. And the ventilation in the sanctuary is such that we open a back window, which we've been doing, and have the heating system running, which is air coming up through the vents. That basically creates a big draft in the room that kind of clears things out and changes the air over pretty swiftly.
Okay, great.
And the
Thanks,
ceilings are,
yeah, the ceilings are like
20, 30 feet
25, 30 feet high. So yeah, we're very, very lucky in that we have this cavernous space, but it has been very empty for a year.
I just want to note, Trina had a really good suggestion. If you want to rename yourself with your church or your location so we can know where you're coming from, that would be nice to be able to see.
Sure.
Thank you so much, John and Jill, for telling us about what you're doing. We're going to invite Drew all the way down in Quincy to tell us what's happening at his church.
Great. So I was asked to talk about some of the metrics that our task force has created that we want to see before we consider reopening for in-person worship. And the task force also has created a plan. Right now, we don't have necessarily a phased approach. And so we might add that depending on how convincing this article is. But just so we like John mentioned, we've been fortunate to have a task force that's been filled with some people who have good knowledge of the church itself, but also of public health. And so we have a Boston University medical school professor who actually just joined our church in January, which was excellent timing for us. And he has really been walking us through we've met weekly since, last May. So these folks have been putting in a lot of time, and we go over numbers that he has, and he always gets everything from the same source, as Megan mentioned in that article, which is important. So we look at the United States 7-day average of new cases. So we look at several national level numbers. So that's number of new cases, the testing rate, the daily positivity rate, and then there's also a 7-day average of positivity. So we do several things from the United States, and then we look at Massachusetts as a state, and then we look at Norfolk County and Plymouth County, where most of our members live. And then we look at Quincy as a town or as a city, and those numbers. Mostly looking at new cases, testing rates, positivity rates. We also look at Massachusetts RT value, which I never knew about until meeting with Aaron, but that is the rate of transmission. Basically, that means for every person that is sick, how many people are they getting sick? And that threshold is 1. And if you're under 1, that's good. And if you're over 1, that's bad. For the last several weeks, we've been under 1, but it did creep up last week. So we'll see. We meet tonight, so we'll see what that looks like. But for each of these, we've also kind of, thanks to Aaron's help, we've created goals that we want to see for each of these. And we want to see most of them in what we would call the green, which is just kind of some levels that Aaron has helped us kind of kind of think of. So for example, the way that the state is on, I believe it's on Thursdays now, they're coming out with, Massachusetts, of course, they're coming out with each city's incidence rates. And so we want to see the city of Quincy to have a 2-week, let's see, 2-week average testing to be, excuse me, the 2-week average incidence rate to be unchanged or decreasing over a 2-week period, and to have that under 10 people per 100,000. So that's kind of an example of a metric that we've set that we want to see before opening. We have a total of, I think, about 13 or 14. So we don't necessarily expect to be A+ on all of these before reopening, but it gives us an idea of how comfortable we would be given local, state, national numbers that we can see. So that's about where we are with that.
Thank you, Drew. I feel like it's so helpful to me to conceptualize this in terms of like those kinds of metrics, as opposed to like, what happens next, which is where I had been. So thank you.
And it's where I would have been if we didn't have Aaron. So we're very fortunate that way.
Great. So Janine Cunningham, would you be willing to share as another Massachusetts resident?
Sure, thank you so much. We do similar things like John and Drew. We have metrics. I first should tell you that we have, I'm in the Old South Church in Newburyport, Massachusetts. And I'm the clerk of sessions, and I chair the task force, the COVID task force. And we're made up of similar people. We don't have any physicians, but we do have a school nurse. I'm a nurse. And we have a professor of biology and a few other people who we meet frequently. And also we've come up with a measure of data that we look at using the Massachusetts.gov site that, yes, it comes out every Thursday. So, and we look at multiple towns surrounding Newburyport because we have like, I think it's 12 different towns that we all kind of come from. So we look at all of those towns to look at, and we're looking for less than a 3% positivity rate, which would put them in the green. And so we monitor that every 2 and try to keep like a 4-week look at, and saying, well, okay, it's coming down, check next week. And we do a combination of different ways of having service. We live stream from the sanctuary using, at high peak times, we had staff, the music director, the organist, a liturgist, and just a few people. Just before the December high peak, we did what we called a soft reopening. Numbers were looking great, everything looked good. So we started inviting people to sign up, and they could come following very strict rules. We had a couple of monitors in place. Everybody had to wear a mask, had to wash before they came in. Windows were open. Yes, we're heating, but you had to get that cross ventilation. And like John, we can sit about 500 people, but it's, a huge cavernous, sanctuary. So we're fortunate that way, and we could spread out really, really well. We marked the benches, the pews that people were sitting in, so that when our sexton came in, he knew specifically what areas to concentrate on, not just clean everything, but the ones that were used a little more, heavily. And we pulled out all Bibles and pews and hymnals and things, so we wouldn't have to be worried about trying to keep those things clean. We kind of follow the same kind of data that Drew does. We look nationally, but we really highly concentrate on our communities. We're hoping to be watching for the next couple of weeks to have a soft reopening for Easter, where a few people can sign up. And then we ask them to sign up only because we want to be able to trace back the data if we need to. But we're going to have, separation windows, masking, we don't do singing, and we just have one or two soloists depending. Our pastor has a beautiful voice, and so she often sings with a soloist off to the side in the pew box that the choir usually is in. So we really have kept that limited. We also use Zoom a lot, and that depends on who's preaching, because not everybody can, come to the sanctuary and do that. So we kind of use a combination of Zoom and we've also done a lot of outdoor services when the weather was a little bit better. So that's sort of what we do, and certainly praying that, we can do some bit of a soft opening. If not, we're going to do an outdoor service. So.
Great, thanks, Janine.
Welcome.
So maybe we can spend maybe 5 more minutes on people sort of sharing what they're doing. I believe there are maybe 2 or 3 additional people. Eric Doss, can you share a little bit about what's going on with Elliot? And then Trina, we'll have you speak next.
Yeah, I'd be happy to. So I won't talk too much about what our reopening committee is doing, because they're really capable and seem to be grounded in the same information that everybody else is. We've got a ton of healthcare workers. The rest of our congregation isn't particularly, they want to be back together, but there's zero pressure to meet before it's safe. And so that's been we're really thankful for that. But the same thing, they're using the same metrics, based on actual reported data, not just the way we feel. Our plan is that we will worship the first Sunday in June outdoors at a local park. And if things meet our requirements, then we'll be back in the sanctuary shortly after that, the next week. And the expectation would be that would be open for anybody who wanted to attend. What we've been working really hard on, because we've seen really good uptake with people being online. Folks are having their parents join. My mother-in-law has been there every week. My parents have popped in. And so we just see creating this hybrid worship model as a really important part of the growth of the work that we're doing. So we are worshiping from the sanctuary, or we are broadcasting from the sanctuary once a month. So we go for Communion Sunday. The rest of the time is all from home. When we do that, there's a sound person, there's myself running the video, a liturgist, or occasionally a liturgist, and a soloist, our music minister, and Heather preaching. So it's really limited. We've got 40-foot ceilings. There's no concern. People are being masked when they're close, but we've got so much space in there that for 6 people, it's not a big deal. But we've had some ideas about hybrid worship. So we're using a PTZ camera that allows us to control. So we've got one camera that can pick up. It's got a number of settings, so we can go tight on the pulpit, down to the table, over to the musician or the pianist and the soloist, and framing all of that in really simple ways that doesn't require a lot of work. So that's been successful for us. Our sanctuary is pretty bright when the sun is out, so we won't be able to use projection in the sanctuary. Projectors work great if you can control the ambient light, not as great if you can't. So we'll be installing large televisions. Those televisions will broadcast. We're going to continue to use Zoom because of the community aspects of it, and we haven't found anything that works better, including Altar Live. All of that has not swayed us. So those screens will project, or the televisions will show the people who are worshiping from home in the same way that I'm looking at you guys all tiled here across my screen. We're going to set up crowd cameras. So we'll use probably a GoPro or something like that to broadcast the sanctuary to the people at home. We're doing that all with some video switchers and things like that. We're going to have a section of the sanctuary that's off limits for video. So if you have families that don't want their children featured, we're going to do that. And we're just practicing every first Sunday. Our intention is about 2 weeks, about a month and a half before we return. If things are looking good, we're going to start broadcasting from the sanctuary every Sunday, just so we can practice and do some training. Megan just shared a webinar that I did a couple months ago. That it was some discussion just about tools and things that you can use. And I will, if it's okay, I've got a link directly to some kind of recommendations and tools. And I'll also, from my website, which is where that is, you can contact me directly. I see a couple of familiar faces, folks that I'm either talking to or have already had a conversation with here. I'm, happy to help out. So don't hesitate to reach out. And that's all I have, unless you want me to say something else.
Perfect, Eric. Thanks so much.
Absolutely, Carl.
Karina, could you give us a little update on what's happening in your community, and then we'll open things up for some questions.
Sure, thanks. I'm the pastor at the Presbyterian Church in Burlington, Massachusetts. And we have been doing all of our services on Zoom. I mainly lead them from this room where I'm sitting from my couch. I live about, like 35 minutes from the church. So it's a little more difficult for me to get to the sanctuary. And we haven't just got set up for streaming from the sanctuary, but I'm interested in finding out more about that. One thing that we have really noticed in the online worship, and I've heard from other churches as well, is that our families, especially with young children and youth, are just really not present in those online services. So we have decided to do an outdoor service. Hopefully we'll keep it the fourth Sunday of every month. We're going to start with Palm Sunday, which might be a little cold, but we thought it was a fun opportunity to create a brief interactive worship opportunity for particularly geared toward our families, and welcoming of anyone who would want to come and just see each other in person. And so it will be outside, masked. We're asking people to bring their own chairs. We're not doing an FM transmitter. So it is a little weather dependent in that way, but we're just going to see what happens. And I'm collaborating with Heather actually at the Elliott Church. And so I think it'll be fun. One thing I've enjoyed about this time is that it has fostered more collegiality, I think, and more collaboration between our churches. I've been able to work with several other pastors and members of both presbyteries and create some worship services together, which as a solo pastor has been a real blessing and a gift of this time. And so I hope that, through some of our hybrid worship options going forward, we're able to still, continue working with one another and share ideas like this. It's been like, that has just really opened up. I feel a lot less siloed than in pre-COVID life sometimes, even though we're all isolated. It's still, we've at least been able to, reach out and connect with each other this way. So thank you all for sharing what you're doing. And, hopefully things will get back to somewhat normal fairly soon. But my church is also not pressuring us to go back to in-person worship. The session right now has decided June at the earliest. And we're just kind of evaluating as the metrics continue to change. So that's where we are.
Thank you, Karina. Megan?
Just to tell you a little bit about where I'm coming from, and then we will have time for questions. My church is a small church. We have about 65 members, and we have no COVID task force or regathering team or hybrid worship volunteer army. We have none of that. So if that's also you, you are not alone. And just to speak to Bob's question a little bit, at the beginning of the pandemic, we went back to some work that we had done. Our sanctuary is on the second floor, which is inaccessible to a lot of folks. And we have been working on this project to build an elevator for a very long time. And at the beginning of that, we did some work identifying our values for our worship space. And the number one value of our community for our space was that everyone can see, everyone can hear, and everyone can participate. And having that background and that foundation made it very easy for us, March 13th or 15th or whatever of last year, when some of our medical workers were saying, we're not going to come to church because we're afraid we might be carrying something. And we said, whoa, if we're having a service that everyone can't see, hear, and participate in, we're not fulfilling our our values. And so we worked hard to make sure that everyone had a computer, that everyone could get onto Zoom, and that this is like the most equitable way that we could provide worship. So that's kind of how our leadership has really held that line, that we want everyone to be able to participate fully and equally. And so to that end, we're going to probably be choosing those very conservative metrics that Wisconsin Council of Churches put out, something more towards the 70% vaccinations and less than 1 case per 100,000. I'm guessing it's going to be something like that. Again, we haven't talked about it yet, and it's okay if you haven't talked about it yet either, but I think that's probably what we're going to do. We're also doing some services in our parking lot, but we're making them extra services so that, again, the access to the online community is always there equally for everybody on Sunday mornings, and then we're doing Sunday evenings. I think we'll do once a month. So yeah, I just wanted to say there are lots of different ways, and I know that part of the struggle of this time, for me at least, has been feeling like every time I see something amazing some other church is doing, I think we should be doing it. And it's like this whole shame spiral, right? Am I the only? Okay, good. So just to say, whatever's working for your community is going to work for your community, and that's the right thing to do. So thanks to everybody for sharing all of your plans and your perspectives. Any other reflections on how you're handling differences of opinion about the regathering process?
I would say that our committee, meets and discusses all of this, and we have to come together with a recommendation. We don't have the ability to close or open or any of that. We make a recommendation, the session, and the pastor then decides, based on our recommendation, of course. But I think having that little group helps, everybody to kind of hear everybody else and what their concerns and issues are, and change or modify the, as needed, if you will. And that gives everybody a voice as well, so.
Mm-hmm.
Yeah, sometimes people just need to be heard, and that's enough.
John Sawyer?
There was a question from Bob Merrill about asking, basically, like, if you've been vaccinated, can you come to church versus people who choose not to be vaccinated? And one of the things that was helpful about the previous webinar that I've kind of started using in our language, talking about reopening and stuff like that, is more vaccinations equals lower risk. So that phrase was just very helpful to me in terms of, like, we can't make you get vaccinated. We can't police it. You could lie to us, whatever, but we just want you to know that more vaccinations equals lower risk. And so do with that what you will, but we're trying to take care of as many people as we can.
Mm-hmm. Thanks, John. I see Eric Doss put in, sort of regarding this question of who gets to return to the sanctuary, said you might consider allowing people who've been struggling with online worship to return first. So if you're not able to engage online for whatever reason, maybe you get the priority to return to the building. Bob, how have you been handling that question that you asked?
Basically, as I just put in the chat, I've kind of stopped my committee because there was this strong difference of opinion. And it was interesting. My scientist engineer types were all about scientific data, and that if we had 0 new cases in our area, then we should open up and have worship for fully vaccinated only, which other people on the committee felt as if was exclusionary, which I agreed with. And so basically I've stopped the committee, and I'm going to continue to basically say, we're not going to worship until everybody can gather for worship. And I'm thinking that's more along the lines of sometime in June or the 1st of July, similar to what President Biden had said in his speech about gathering for July 4th. I had presented that as an idea in late January when vaccination rates were pretty slow in New Hampshire. Fortunately, they've picked up nicely. And so it's looking as if more and more people are getting their vaccinations. So that's good.
Great, thanks, Bob. Jill?
Hi, yeah. So I'm going to just share here, kind of like I do with the COVID task force in Bedford, a little bit of the school perspective. Some of the things you were discussing, Bob, sounded to me like, are we looking at equality or are we looking at equity? There are folks who are more in need who have struggled. And there has been in the public school setting, at least in New Hampshire, I can't speak to their neighboring states, but there has been a priority return to school for those students who are faced with more struggles at home, whether that's food insecurity, whether that's a safety concern, whether that's a family work concern, whatever the case may be. We have had priority return for students, for those who are in need. And I think obviously this it's not necessarily apples to apples if we're talking public school and we're talking private worship settings, but at the same time, I think there is precedent for equity rather than full on equality, because we know that some of our seniors who are isolated and are lonely or struggling, or folks who have a lack of Wi-Fi access or whatever the case may be, who are not doing okay at home, who need to return, they can be prioritized in a way that is loving and Christian and hospitable, and not so exclusionary, not so black and white.
Thanks, Jill. Eric Doss?
Nope, that was it. I just wanted to, you
it.
made the point already for me, but thank you.
Perfect. Yeah, okay, great. What are any other questions that people have, or does anybody else want to share what they're doing or get any feedback on that? Larry Jones?
Rob and Larry, yeah.
Well, I'm connected with two churches. I worship at a congregational church in Middlebury, and I moderate the session of a Presbyterian church in Burlington, Vermont. Both of these churches have, with open minds and with flexibility depending on what develops, but both of these churches have said September is going to be when we might reopen. In fact, the Burlington church, which consists of about 50 members, and they meet in a downstairs room of the Episcopal Cathedral at 4 o'clock in the afternoon. So they don't have drop-ins. They might put off meeting as a group until the new year because everybody's older. It's a downstairs enclosed room, and they really don't want to lose anybody, even make anybody sick. The congregational church has a huge sanctuary and is a liberal church, and everybody's getting vaccinated, essentially. So they're thinking September might be the opening. But we also had very great success with 4 outdoor services last fall, and could conceivably start with outdoor services in this coming fall. But both of those churches are saying we're not going to. It's always a risk, but we're going to minimize the risk, and so we're not going to approach opening until we're really sure that things are basically as safe as they can be.
Thanks, Larry. Rob, did you have a comment or question?
Yeah, thanks, Carl. Thanks, Megan. Both of you really appreciate this space and sort of what everyone's sharing and the pastoral word that it's okay if we're in different places and along this journey. We at Church of the Covenant in downtown Boston are largely just kind of been in that space where we've said we're not doing this until. But we haven't done the metrics yet. We're most likely, we've thrown a similar date, Larry, of September at this point, just to kind of stave off some of the expectations, but then saying pastorally, we may open up some creative things and space in the summer. We don't have outdoor space. We may try to do the public garden in Boston and things like that. But two of the questions that come to mind for me are, and I've probably brought this up before in some spaces with you all, but has anyone given some thought, or do people know of resources that are thinking about how to maintain access, like the Zoom idea, knowing that some people will always stay at home once we regather, but not transforming our spaces. Ours is one of the older, big vacuous spaces with stained glass, keeping that a place without screens for the sake of a contrast, a spiritual contrast for grounding for our people after a year of unbelievable focus on screens. So just that tension is what I'm feeling, and I'm wondering if maybe there's one room with a screen or things. But has anyone given thought to that? That's one piece. And then the challenge of visitors. We do get visitors every Sunday, and how do we ever get to a place of limiting numbers? So I'm sort of thinking we can't really open up until we can really open up to all. That's the place. But those are just unformed questions, thinkings, ponderings. Thanks.
Thanks, Rob. Any initial reactions to Rob's thoughts? Jill, I see your hand up.
Yes, I like what Rob had to say, because I think one of the factors that is a challenge, and John's heard me say this before, is what about the folks who kind of go rogue? Like, we can set up all these protocols and procedures and hope that people will comply, but we don't really have a lot of recourse if they don't. And so even if we set up all these parameters, if somebody comes running up and hugging, it's really difficult for us to be enforcers of these things. Even though we know, like, we're thinking greater good here, we're trying our best to keep everybody safe and healthy, and we hope that everybody's on board with that. But if they aren't, it's really hard to enforce that. So I understand Rob's point of view of like waiting until everybody can be safe, and even if somebody came running up for a hug, that's not a problem. Or if somebody chooses to sing when we've told them the assembly isn't singing, that we don't have to be the voice police or whatever the protocol breach may be. I think that's a challenge in my mind, to try to maintain a Christian sense of community when not everybody may be on board with all the health and safety protocols. Thank you.
Yeah, thank you.
Yeah, I would say the same thing, that's one of the reasons that we've punted as far as we have, and potentially may again. And it's not necessarily the people who will break the rules, but if you've ever been to Elliott Church, we take like 20 minutes during the passing of the peace to talk to everybody. And so if we can't do that, and we can't eat downstairs and share coffee and bring, like, there's a cake every week for something, right? Like, if we can't do that, then I think that's part of the reason that we haven't had a lot of pressure to be back in the sanctuary, is because if we can't do those things, then we might as well stay home. But also to Rob's point is, like, yeah, it's going to be a struggle. Like, we don't have any, we've never had screens in the sanctuary, to the best of my knowledge, unless it was like for a particular thing, we're going to show this. So that's going to be a change, and like, it's going to be tough, and I don't have an answer, but we're right there with you.
So the question and an answer, in the chat there, about just what thoughts are about, if returning is in September, for people who have articulated that, what are the expectations about masking and distancing? And then a specific question about special arrangements to serve communion to reduce as much as possible the risk of transmission.
We're going common cup all the way. Everybody drinks in the same cup. No, just playing.
As long as you wipe the edge. Right?
Yeah,
that's right.
No, but John, you've been doing communion, haven't you? Somehow in your sanctuary, how have you been serving communion when you have people there?
Yes. So we so we have opened additional people in the sanctuary, except for the first Sunday of the month, which is when we do communion. And so on that day, our deacon of the day and our elder of the day will basically bring enough bread and juice up for just the people who are doing the live stream, and then everybody is given that before the service and holds it with them in the pew. And then when the time comes for people at home to to break the bread with me, the people in the pews will break the bread. And we're really leaning on the Holy Spirit is what makes the sacrament real and present and gathers us together around the heavenly feast, part of our theology, because, you know, since we can't be in the same room, gathered around the exact same table, we're trusting the Holy Spirit to do the work. So right now we haven't figured out how we would do communion to like everybody in the room. And so we're limiting that on the first Sunday of the month.
Great, thanks, John.
Yeah.
John Siders.
Yeah, one of the things about with communion that we've done here is we've had parking lot services end of last summer through the fall, almost till Thanksgiving. And it got cold, but we still had like 30 or 40 people who would show up each week. And we put them in every other parking slot. And when it comes to communion, we've asked people to bring their own elements. And that has worked fine. Nobody's pushed back. Nobody's had a problem with that. I could foresee doing that same thing when we come back into the sanctuary, but we don't have a date for that. We're still, our plan is to go back in the parking lot Palm Sunday and keep that up all through the summer at this point. Just a thought.
So what we did was we had people bring for our outdoor worships, bring their own cups. And for one person, that was dumping his coffee mug out because he forgot and like wiping it down. And so we got bread and individually packaged like a family mini loaf of bread. And so we handed out the bread and filled up your coffee mug or whatever you brought.
Thanks, Eric. So we're coming up on an hour. And one of the questions, as Megan and I were talking about it, one of the questions we had was if creating this space or sort of reopening the space again at some point is helpful to continue the conversation. We're doing this 2 weeks after the first one. We don't know, like, do people want to gather again in a couple of weeks to talk about this, or a month out, or do you just want to reach out to us or to some, leaders within the Presbyterian, ask for it again if you want it? How are people sort of thinking or feeling about that?
Would it be helpful to you to hear from, like, if I volunteer Drew's lovely med school professor, like, would it be helpful to hear from someone like that about how to set up metrics for your own church? Or I know, Trina, we were just started talking about kids. Maybe it would be helpful to talk about kids one time, or
yeah.
Lots of nodding.
After
Easter?
Yeah, maybe after Easter. Oh, man.
Definitely after Easter.
Yeah.
Yeah.
Okay.
I just really quick wanted to say about kids and worship. I don't want to open all this up, but I actually think that our kids will be a lot better about most of this stuff in worship than the adults, because many of them are going back to school. They're expected to wear their masks all day, every day. Even the littlest ones among them are doing really well at that. And so I think that our kids will be better trained than a lot of our grown-ups in terms of how to do all these things. So just throwing that out there.
Thank you, Trina.
As a parent of a fourth grader.
That's awesome. Cool. So Carl and I will, yeah.
But just, yeah, it sounds like we'll try to do something after Easter. Maybe we won't do the week immediately after Easter, but just like 4 weeks out.
I'll be on vacation that week.
Yeah. So maybe we'll look around, mid-April the 14th or something.
Well, I'm just going to close this with a prayer quickly. This is from Out of the Silence into the Silence Prayers Daily Round. If you don't know this, it's from a monastic community in Australia, and it's just kind of weird and cool. I like this is kind of a weird time. So this is one of the canticles for Lent, which I thought was really appropriate. So let us pray. Praise be to you, O God, calling us to the strangest of ways, turning us inside out, upside down, revealing a new world to eyes that are open. Fools to the world, we know the wisdom of God. Unknown, we cannot be ignored. Dying, we still live on. Disciplined by suffering, we are not beaten down. Knowing sorrow, we have always cause for joy. Poor ourselves, we make many rich. Penniless, we own the world. Praise be to you, O God, calling us to the strangest of ways, turning us inside out, upside down, revealing a new world to eyes that are open. Steadfastly, we turn our wills towards God to meet hardships and afflictions, hunger and weariness, illness and failure, with sincerity, insight, patience, kindness, speaking the truth in love, resilient in the power of the Spirit. Praise be to you, O God, calling us to the strangest of ways, turning us inside out, upside down, revealing a new world to eyes that are open. Amen.
Amen.
Thank you for doing this.
Thank you all for gathering. Yeah.